afternoon. I'm Dr. Richa Thukral, Senior Consultant Pediatrics and Neonatology, and an asthma and allergy specialist at Apollo Hospitals, Noida. Today, I'll be speaking to you about allergies in children, common symptoms, and how do you test for these allergies. So, as we know, in the past few decades, the allergies have been increasing in alarming proportions all over the world, and allergies are increasing in India also. So, around 15 to 20% of children and adults in India are suffering from some or the other form of allergy. Now, what do we mean by allergy? Allergy is basically an hypersensitivity reaction of your immune system to a harmless substance which we call as an allergen, to which most people do not react. So why do some people get allergies or some children get allergies and other people don't? So there is a genetic tendency to develop allergies, plus there is an environmental impact, which may be climate change, which may be westernized lifestyle, which may be because of the increasing levels of pollution in the world. So, what are the signs and symptoms which make you suspect that you or your child may be suffering from allergies? So, if there are frequent coughs and colds in the child, which are happening too many times in the year, and they do not get better within a normal period of around 7 to 10 days, in which most viral infections tend to recover, then it may be a symptom of allergy. Also, these do not respond to your regular medications and syrups. So, what the child may be having is a constant runny nose. He may have a blocked nose. He may have itching in the nose or sneezing. And also, there may be snoring in the night. And they can also have sleep impairment. So, these are all signs of what we call as allergic rhinitis, which tends to affect a lot of children and also adults. Also, the child may have frequent episodes of cough, which is typically dry cough, and also it tends to be worse in the night. And these also tend to get prolonged and do not get better soon. This cough can also be triggered by playing or exercising or running. So, if this persistent cough, if the child is suffering from this persistent cough, it can be a symptom of allergic bronchitis or what we call as childhood asthma. And in some children, it can be severe also. They can have associated wheezing. Wheezing is basically a musical sound which you hear in the chest when you auscultate. And the child is also breathless along with that. So these are more severe forms of asthma. Other common allergy, which we see mostly in infants and younger children, is atopic dermatitis, or what we call is a skin allergy or eczema. So they tend to have a dry skin and itchy skin. Sometimes it is even red and oozy. So this is also common in children and also sometimes in older children and adults. The other allergy that we see, which is not that common, is food allergies. So, food allergies is that after a particular intake of a particular food, the child can have rashes on the skin, he can have swelling of the lips or the tongue, they can have vomiting, abdominal cramps, diarrhea, and sometimes even there is passage of blood in the stools. And the most severe form of allergy is what we call is an anaphylaxis. This is a life-threatening form of allergy that is after exposure to an allergen, the child can have a breathing difficulty and can have a bad rash and even can have a severe drop in the blood pressure, which can lead to collapse or even death. So, what are these allergens which tend to trigger allergies in children and adults? These allergens can be airborne allergens. So, in airborne allergens are the commonest. They can be indoor or outdoor. In indoor allergens, the commonest is your house dust mite. So, the house dust mite is the commonest cause of allergic rhinitis and allergic asthma in children and adults. And this is actually a microscopic mite which is present in almost every house. These mites tend to be there in your mattresses, in pillows, in upholstery, in carpets, in curtains, and even in soft toys. So they trigger allergic symptoms in a lot of children and adults. Other airborne allergens which are indoor are basically maybe cat and dog dander, and it can be cockroach, it can be even molds, the spores of molds, especially if the house is damp. These are the indoor allergens which trigger allergic symptoms. The outdoor allergens are mostly pollens. So it can be a tree pollen, a grass pollen, or a weed pollen, depending upon the season and the geographical area. The foods which are very commonly implicated in allergies are mostly in children. It is the commonest is cow milk, and then it is egg, and in older children and adults, it is peanuts, other tree nuts. It can be wheat, soya, fish, and shellfish. So these are common foods which can trigger food allergies. Also, some people may be allergic to insect bites, which is maybe a honeybee, wasp, or a hornet sting can trigger allergic reactions. Uh, Also, there are drug allergies, allergies to latex, then there's contact dermatitis to cosmetics and all. So the list is endless. So now we come to the next important question, that is, why do we need to treat allergies? Now, you need to treat allergies because what happens is an allergic asthma or an allergic rhinitis, which is continuing throughout the year, significantly impairs the quality of life of the child. And not only impairs the life of the child, but also of the whole family. Because the child is not able to indulge in his normal activities, he is not able to sleep properly. So the next day he is fatigued, he's sleepy, he cannot concentrate in school. So the academic performance tends to go down significantly. The second most important reason is that things like allergic rhinitis, they tend to predispose to frequent ear infections. They may have a sensation of blocked ear. They can have sinusitis. So these recurrent infections can be predisposed by your allergic rhinitis. Also, the asthma, if you're not treating in a child, he's having persistent cough and recurrent episodes of wheezing. What happens is if you don't treat it properly, it will affect the lung function. So there is certain remodeling of airways in the lung, and the disease tends to get worse as they grow older. And it is difficult to control that asthma later on with medications. So, for these reasons, we need to pick up allergies early and we need to treat these allergies early. So, next we come to what are the common tests which are available to test for these allergies. So, the gold standard test for testing is basically a skin prick test. So, what we do in a skin prick test is that we put a drop of the allergens, these are all commercially available. We put a drops of these allergens on the forearm or the back of the child, and we scratch the skin with a toothpick like device. It's a very small device. We scratch the skin through the allergen drop. So if you have antibodies to that allergen, that is usually present in the skin bound to certain cells called mast cells. So once the antibodies react to the allergen, they will give a typical wheal and flare reaction. That means that area will become red and swollen, and there will be a surrounding erythema. So this is called a wheal and flare reaction, which is something similar to a mosquito, what we see in a mosquito bite. So depending upon this reaction, the size of this reaction, the allergist can make out that what allergens you are sensitive to. The other test which is done is a specific IgE, which is a blood test. It is done by the immunocap method, and a lot of labs offer these allergen panels in which we can do these tests. If tested for the allergens, then we come to the treatment part. So the treatment of allergies is, once we know what allergen you are sensitive to, we can guide you about how to avoid those allergens. That is the first pillar of treatment. The second is, of course, the medications. So antihistaminics or intranasal sprays or the inhalers, they can help in controlling your symptoms of allergies. And the third most important treatment, which has come up recently, is immunotherapy, in which we give oral drops. It is like a vaccine. Its oral drops are given for a couple of years, and this medicine, this immunotherapy, it can desensitize your immune system. So this is the only treatment which is available to reverse your allergies, decrease your symptoms, and decrease your reliance on medications. So, to conclude, I would like to say that if you feel that you or your child are having symptoms of allergy, then you need to consult an allergy specialist for that. At Apollo Noida, we are offering these allergy and asthma services, so which include a detailed consultation with an allergy specialist. Then, depending upon your history, we decide to do a skin prick testing for the relevant allergens, or we can offer you blood tests. Also, a pulmonary function test can be done to look at your lung functions. And we can guide you about the use of medications, and we can teach you about the dose, the duration, and the proper technique of using intranasal sprays and the inhalers. And we are also offering you immunotherapy to certain allergens which can probably reverse your allergies. So I'd like to end my talk here. Thank you so much. And I would like to wish you a healthy, happy, and an allergy-free life.